Hello. Welcome to another video from 10x Investor Education. In this video today, I would like to talk about a company called Q Health. The new IPO that is coming this week or next week. The symbol is HLTH. Is it just a one test wonder company? Is it risky? How many shares offering? Let's get into the review briefly and see whether you guys are interested to know in this company or not. Okay, this is the company I was talking about, is available in Robinhood to apply. The symbol is HLTH. It's Q Health, health technology company that develops and manufactures portable compact medical diagnostic products, offering including individuals, enterprises, government agencies and healthcare providers access to lab quality testing at home. So lab quality testing at home. So the main product they have right now is molecular at home test kit that they have been selling to government in millions, and that's how they are making money right now. Okay, so let's get into the summary of $200 million IPO. So September 15th, pretty recent, 2021. Q Health, which develops and sells molecular home tests for COVID-19 and other diseases, announced terms for its IPO on Wednesday. This is a San Diego-based, California-based company. It's a $200 million IPO, offering 12.5 million shares at the price of $15 to $17. Okay, and Q Health also fully diluted market value of, so at this price, the market value of the company is $2.4 billion. So the company's Q integrated care platform consists of hardware and software components. Basically, I'll show you in a minute how they take the test and all that. Q health monitoring system, Q data and innovation layer, Q virtual care delivery apps. It's a lot of marketing buzz terms. End of the day, you need to have. So this is how it works. So you need to have. You take the kit, and then you collect from your nose, and as simple as that, and put it, and in your phone you check app. Okay, as simple, that's as simple as it is, and you'll get results in phone in couple of minutes. And this is a throwaway cartridge that they sell it. So basically what they're trying to do is, first of all, as you can see, they want your information, they're collecting your information. So that is the first step to get you. Okay, the second step is app based. Everything is app based. Okay, so tomorrow they can sell. Next year when they get FDA approval, they can run multiple tests, and this is similar technology, and they can use the same platform for any kind of test. Okay, so let's get back to the IPO review again. So the most important thing is, this particular test has been authorized by two UUA, both FDA and Europe Union, and also India and other countries. Okay, Q has 5 additional test kits in late stage technical development. Okay, so this is the only COVID test available from them, no other test available. So 100% of the revenue coming from this test. Okay, so they are still working on these influenza, respiratory, fertility, pregnancy and inflammation, these tests also, and I think at end of the year 2022, that's where they're expecting. Okay, so Q Health was founded in 2010 and booked a $220 million in sales for last 12 months ended June 30, 2021. Okay, so they didn't have much revenue before COVID at all. Okay, so how did they make suddenly in 2 years 220 million? That's what we'll get into. It plans to list on NASDAQ under symbol health. Okay, so a lot of people think this is one wonder company. Yes, it's a very risky company, but if you look at underwriters, Goldman Sachs, Morgan Stanley, Cowen are joint book runners of the day. Okay, so these are some of the top companies. They are like small, not small companies. So certainly they are backed by big companies, and initial funding is also done by Johnson & Johnson. So there are a lot of big companies behind this company. It's a risky based on one product, and if any of the test doesn't work, and then the stock might fall 30-40%, but they have crazy revenue. Okay, so there are so many companies, just depends on government, and at this point I can't even buy their test in retail. I don't even know the price, but so government, they have been selling government millions of tests. Okay, so this is exactly who buys their test. So HHS Health Services launched a pilot program in 5 states to introduce rapid point of view COVID-19 test. It's the same test NBA used to create so-called bubble and finish this season. The test manufactured by California-based Q Health. Okay, so in June of last year, government spent close to $480 million on this company contract. Okay, to actually manufacture this test. So far, it's most federal government HSS takes this test and supplies to different states, and those different states they can be using for public venues or even for federal government employees for testing and all that. Okay, so a lot of NBA and NFL and a lot of this and even public venues where it happens, these are the tests that are used. Okay, so that's the reason why these tests are very famous, very popular, this company. There are several companies which make a lot of antigen based tests, but there are very few companies that make molecular based at home based tests. In general, molecular based tests are considered more accurate than antigen tests. Okay, so the pilot program adopted by Florida, Louisiana, New Jersey, Texas, and Alaska, and hundreds of thousands of tests and for NBA and all that. This is where they make money. Okay, so they don't have to sell to you and me, but they just sell it to the government and different authorities and different. So as I said, um, you know, HSS, Defense, and NBA, and there are a lot of clients. That is how they get their revenue from. Okay, so this is how we can apply for this IPO in Robinhood. Okay, so next, coming back to give an example of other tests. Okay, so the lab quality test similar you can get it from other, for example Quest Direct. So compared to this, they test with this. Okay, so what happens, even if you can buy in Amazon similar test, so what happens is COVID-19 test collection kit. Okay, they don't actually give the results. So you can basically take this and use your sample and then given in a lab, and then later you can get your results on your phone. Okay, so but this is exactly not same as Q Health test. Okay, similarly from Quest Direct, so $119 plus $16 physician fee. So these are not cheap. Okay, I know Q Health doesn't give you the rate, but these are not cheap, and there is, I think, based on the revenue, I think 2021 could be the biggest revenue generator for them. I don't know how the next year will be because COVID is peak in 2021. So that is one risk for them for sure, unless they come up with a lot of tests next year and actually diversify their revenue. Okay, so again we can go to SEC filings, and then we can quickly see what they are saying. As I said, 12.5 million shares with 15 to 17. The symbol is health. Okay, initial public offering. Obviously, the Morgan Stanley is the lead manager here, and Goldman Sachs and Cowen. So these are all big companies. Portable test. You will get these 3 pieces, and then you put your specimen into this cartridge and put the cartridge into this box, and then you will get the results onto your app. Okay, that's how it works, as simple as it. So if you go back, the main thing I want to focus is on, so in a competition. Okay, so most of the risk factors are the competition. Competitors with the diagnostic testing platforms include private and public companies such as Abbott Laboratories, Becton Dickinson Company, Biomedics, Biorad Labs, Danaher Company, Elium, Everly Health, Hoffman. You can go on. So hundreds of companies, Laboratory Corporation of America, Quest Diagnostics, as I just showed you, Quest, they have all these home selection kits. Okay, so in my view, I don't think for COVID-19 test anytime they'll be competing with any of these companies. Okay, their competition is government, where they're not selling one test at a time, but they are sending 100,000, 50,000 million tests to government, and the government is further sending tests to different states and different venues, public venues. Okay, and given that government is mandating either you do a vaccine and or get this test to come to work, then I would think that a lot of this test has to be sold to government. That is one thing. What is good news for this company? Okay, so certainly the risks are one test company right now, and the advantages are they have contracts. They have built-in contracts where they can generate millions of revenues for this year, for next year, and all that. So I can see both positive and negative. It might go in IPO up. If there is a bad news, this is certainly going to go down like anything. That is what risk factories. Okay. At the end of the video, this is what I'm showing on CNBC, and you can get an idea. You can see the CEO. He is from UCLA, and a lot of companies actually funded this company. You can look at the video on how he talks about this this particular test. Okay.
Breakthrough now in COVID testing at home. The FDA granting emergency use authorization for Q Health's rapid COVID test, making it the first molecular test for COVID-19 authorized for at-home use without a prescription. Joining us right now, first on CNBC's Q Health co-founder and CEO, Ayub Khattak. It's great to see you this morning. We've been following your story since the beginning last winter and into spring, and now this device is available for the public. How easy is it to get? I've now demoed it, I should say. I have it right here. This is the box you put it in. It's very easy to do. But tell us how expensive this product is ultimately going to be now, and how available it'll be.
Yeah, so as you said, on Friday, the FDA announced that they've authorized our product. It's the first ever over-the-counter molecular test. Molecular means it's on par with the central lab testing techniques, so the accuracy is on par for both symptomatic and asymptomatic people. And for the first time, this is like having a lab in the palm of your hands, and this really is a breakthrough. We're really excited about trying to catalyze a shift from centralized health testing model, which hasn't been the best, and being able to have this paradigm shift towards making a more accessible, convenient, easy to use healthcare system, and this will lead the way.
Okay, so tell us how much is the box going to cost? This is the box here that you actually put the test into, and I'm going to open this. I'm going to do it in front of everybody so we can see how it works. How much is this going to cost?
So
so I open it up here like this, just so everyone sees what it is. You get this at home. You take this. This is the little box that you're going to put your nasal swab in. I won't do the stuff it attaches to your phone, but then you're going to put it up your nose. Everyone can watch me put it on my nose. But as I said, tell us how much is this going to physically cost people?
Yeah, so right now we're distributing. We have this contract with HHS and DoD, where it was a $500 million contract where we scaled up our manufacturing. We're onshoring our entire supply chain, and we're starting to really produce large numbers. So we've delivered several 100,000 tests to HHS and DoD on the way to 6 million tests. It's being used in nursing homes. It's being used in K through 12. It's being used in fisheries. And as soon as we're through that, we'll start to deliver more to consumers.
So, you're killing me, because I demoed the thing. I'm talking about it on the air, and you're not telling us what the cost is. And then I want to talk about the efficacy of it.
Yeah, so the cost for the test it's going to be, we haven't announced pricing. It's going to be comparable to other tests. And honestly, over time, we hope that insurance companies pay for it because as you pointed out, as the CNBC pointed out in the last segment, the costs are enormous for having COVID. And so being able to prevent spread, that everybody benefits, your payer, your insurance company, your employer. So ultimately we want to make it free. And in the meantime, it's going to be, comparable to other test pricing.
So, Shepard Smith here.
So you get the idea. So nursing homes, K to schools, lot of states, and then basically Department of Defense, HSS, lot of government agencies. So they are not competing with Abbott at this point. They are competing with basically, in my view, Quest. They are competing with basically Laboratory of America. Okay, so in order for me to get this kind of test, I had to go to Quest Diagnostics, wait in a queue for 3 hours, and then or 2 hours, or take an appointment early, and then submit my specimen and wait for results for next day. Sometimes the PCR test comes in, takes 3 days. Okay, so this is, I think, revolutionary, and they are going to eat the market share of these public companies, Laboratory of America and Quest Direct, and that is how it is going, because it's impossible for the government to maintain, you know, thousands of COVID test sites and then spend money on that. And this is more practical way to this. Okay, so as I said, this company has more risks and rewards. One reward is government contract, and multiple is a government contracts, and one risk is one test. Okay, so based on the founders and people they are hiring, I think they will release a lot of other tests by end of the year. I think this company will survive. I don't think this company is one test magic company. Okay, so hopefully you'll get an over idea. Thank you for visiting, and this is not investment advice. Please click on the like button and let me know what do you think about this company if you are interested in investing in this company. Thank you.